Love if you could speak on POTS and neurostimulation devices, if you recommend them or not. Yeah, so neurostimulation devices as a context are they're a thing that we use as a tool. Now the caveat would be that so many people with POTS or other dysautonomia symptoms or even concussion can easily find online people that promote using them, but for a lot of people it's not the right tool. Like we just had last week, we had someone who had been using a vagus nerve stimulator. And when you measure it, the vagus nerve is fine. The symptoms they have nothing to do with the vagus nerve, but they're told to use one because they have POTS. Actually, we found that it was going to depress the things that they were experiencing and working against their symptoms. Kind of with that caveat, some of the neuromodulation devices we use are specific to the neurogenic problem that people have. So we use things that can stimulate one nerve, and that might be something as simple as like a TENS unit or something with a probe or a duo probe, something like that. Then we use other systems like a Neuro 20 system, which is fantastic, but the Neuro 20 system is more complicated because it's 20 different electrodes that use paired musculature, and we actually can run it through different parameters. So like if we want to mimic running or walking or cycling or throwing, we can do that through that suit and the control system, so the way that those pads actually activate. So that can be really helpful if we're trying to get someone that's got a neuropathy to be able to walk again or something like that. So all of these things have their own place, but it's really important that you apply them in the right spot. If you just apply it because someone says you got POTS, you should stimulate your vagus nerve, that is a terrible way to approach it. And I hope that's not what people are doing. Thank you.